Gallery. Okay, so today we're going to be talking about nutrition and health, brain health. This is something that um, has come up before. This is something that patients often ask me about. And so while I'm not necessarily an expert when it comes to nutrition, I do know a good deal about nutrition, and I've done some research looking at how do we help our brain. And so I will paraphrase or front this with I'm not an expert, but this is what I have learned, and this is what I have when I've gone to some of the national conferences. I've gone to the sessions about brain health, because if we accept that addiction is a disease of the brain, and certainly mental health we know is a disease that affects the brain, we need to be able to look at how do we actually help heal the brain. So what makes a brain healthy? Your brain needs carbohydrates, protein, it needs all these different nutrients. And there's good and bad macronutrients. Certainly we know there's some things that are really good for your brain and some that are not. Brain cells can't store energy, and therefore they require a steady stream of glucose. So, and that's where we talk about being hangry. I don't know about y'all, but if I go too long without eating, I get a little cranky and I don't think very well. And that's because my brain can't store glucose. It can't store that, and so it needs a constant stream of it. Complex carbohydrates give your brain the steady stream of energy it needs. So you get those from fruits, grains, not Snicker bars, even though when we are hangry, we tend to go for Snickers. And I like their marketing where they actually have some Snicker bars that are labeled hangry. But we need fruits, grains, those complex carbohydrates, high protein foods. Those help balance the blood sugar. And some research has pointed to spikes in blood sugar as one of the precursors to Alzheimer's. So that's kind of some early research out there. It's actually kind of interesting, you know, when they talk about what causes Alzheimer's. And if you look at the way a lot of us eat, where we eat junk, and then we get these blood sugar surges, you know, it'd be interesting if that does indeed result in Alzheimer's. So, you know, people who consume the low-fat diets, especially low in cholesterol, are at risk for depression and suicide. And part of that is because your brain functions off of fat. You need fat to function. When I'm working with some of my eating disorder patients, particularly the really skinny anorexics, we don't necessarily bother with putting them on an SSRI because their brain can't actually absorb the medication, is the way our psychiatrist has described it to me. It doesn't work because there's not enough fat in their system to actually have the medication work in the brain. And risk of dementia is reduced by when we cut the cholesterol in our diet. And so one of the reasons behind that is cholesterol actually clog those arteries, restricting blood flow, restricting nutrients, et cetera, et cetera. And of course, when you have high cholesterol, you're more at risk for stroke, other things like that. Proteins break down into building blocks called amino acids, and amino acids are actually what our neurotransmitters are built on. So one of the alternative supplemental, medication, not the right word, that I've discussed before is N-acetylcysteine, which is an amino acid. And N-acetylcysteine, also called NAC, has been shown to reduce cravings for gamblers, alcoholics. It's also been shown that at the really high levels, so like your 2,000 milligrams per day, to actually help with people with OCD. One of our previous psychiatrists who really studied eating disorders, when he had a really tiny anorexic girl, instead of putting her on an SSRI, he would put her on NAC at the high doses. And we actually saw that obsessive thinking, that ruminating that you often see in the anorexics, that actually changed. It was kind of like she was actually, her brain was stopping that obsessive thinking and actually able to focus on healthy things. So that's kind of cool. So the amino acids, the compounds, enable brain cells to communicate with each other. Examples of common neurotransmitters: dopamine, serotonin, GABA, norepinephrine, endorphins. Those are all ones that we commonly talk about that are affected with mental health and substance use. So this was interesting to me. Tyrosine, an amino acid in protein foods such as meat, fish, tofu, is a precursor to the neurotransmitters dopamine and norepinephrine. And so those neurotransmitters in particular affect mood and energy levels. So if we're working with patients that are really struggling with mood, energy, even motivation, it'd be interesting to know if we gave them foods with tyrosine in them, would that improve their mood and their energy level? I think that would be a fascinating study to do. Someone's probably doing the study right now, but we just don't know about it. So the amino acids, like I said earlier, are building blocks for proteins and neurotransmitters. So there are 20 amino acids that we know of, and 9 are considered essential. So they're called essential because our bodies don't make them naturally. So a lot of the amino acids our bodies do make naturally, but there's 9 that we don't. And so we have to get those from food. Those are not ones that we just are going to make up in our head. So things that can give you those essential amino acids: quinoa, goji berries, hemp seeds, avocado, coconuts, papaya, lettuce, carrots, celery, spinach, almonds, sunflower seeds, not seeds, cabbage, onions, eggs, dairy, meat. So if you look at that, it's actually very healthy food. Those are the avocados, coconuts, those are healthy fats. Quinoa is a nice mix of protein and that whole grains, that complex carbohydrates that you need. So those are foods that when we talk about what are the foods that help heal the brain, they are foods that are on the healthier end of the spectrum. B vitamins are also pretty essential for us. They can improve your mood, increase your tolerance to stress. When my grandmother was in her last years of life, she'd get an injection of B12 on a frequent basis because she would start to not function very well, and they'd give her a shot of B12 and she would kind of perk up for a little while. So you really look at how those vitamins can affect you. But B vitamins in particular, B12, one of the most common vitamin deficiencies in the US, estimated 40% of adults are deficient. So that can lead to the mental disorders, brain fog, memory loss, dementia, depression, Alzheimer's. And then there's a nice little picture of B vitamins where you can get those from. Sunflower seeds is one of the places you can get them. So again, if you have a patient that maybe they are resistant to medication, I'm not saying if they eat certain foods, their mood, their affect is going to just change. I'm not saying that, but it's not going to hurt them. It's going to help them maybe start to think better, function better. It might make them feel like they have, I know I've got some patients that feel like I don't want any more drugs in my system. Like, okay, well, fine. But maybe giving them some insight to what their brain does need through food might help them get on a better path. Vitamin D. Vitamin D, they call it the sunshine drug. You get it from being exposed to sunshine because vitamin D can improve your memory, your mood, ward off cognitive decline, dementia, Alzheimer's. When we talk about SAD, the seasonal affect disorder, comes from less sunshine, so the body makes less vitamin D. It's also important to note that it's nearly impossible to get enough vitamin D from the sun or from food. So a lot of our foods have been fortified with vitamin D. That's relatively new, but you'll see loaves of bread that say, fortified with vitamin D, or cereals. A lot of breakfast cereals are fortified with vitamin D because you can't get enough of it from just food and sunshine. And then magnesium. Over 300 different metabolic functions, so magnesium is pretty significant. It's not something that we necessarily think about. So having enough magnesium equals improved focus, concentration, mood, reduced cravings, increased energy, more resilience to stress, better sleep. It's so good at helping you sleep and relax. It's often been called the original chill pill. I myself take magnesium, and I notice that I feel better when I take magnesium. So that's just something I've noticed within myself. And then your omega-3 fatty acids. The psychiatrist that I was mentioning earlier, who used to work with our eating disorder patients, he would say over and over, if you could take only one supplement, it would be DHA, which is one of the fatty acids. One of those essential things I mentioned earlier, your brain functions off of fat. If you don't have enough fat, particularly specific these types of fats, it can be really hard for your brain to function at its optimal peak. You've noticed that a lot of the vitamins that I've mentioned affect memory loss, depression, dementia, Alzheimer's. And so when we talk about, while your diet can't fix, quote unquote, these conditions, it can certainly help them. It can certainly make the symptoms less significant. And so they've also looked at some studies that seniors with higher levels of DHA are nearly half as likely to develop dementia or Alzheimer's. So that also seems to be a protective factor with DHA. And so you want to look for those wild-caught fatty fishes like salmon. I personally hate salmon. I would rather take one of the supplements because I just can't stand salmon. But I'm like the only person in America that hates salmon. So water, here's another one. So water is pretty essential for your brain functioning. 73% of your brain is water. And really our body is made up of a lot of water. And so we need to make sure that we've got enough water in our system. So 2% of dehydration to affect your attention, memory, and other cognitive skills. So that's one of the reasons why drinking is so important. particularly our patients, they may still be flushing out some toxins from their system if they've been using for years. Their body's probably still processing stuff out, so needing to have that fluid intake. 90 minutes of sweating can shrink the brain as much as 1 year of aging. So to me, I read that and I go, oh, well, hey, I'm not going to exercise. Exercise is bad for me because it shrinks my brain. But really, what they're saying is you need to make sure that if you are sweating, that you are replacing the fluids in your system. And the effects of dehydration on the brain can be so noticeable that they mimic the symptoms of dementia. And so water, very important. Your brain is made of fat as well, 60% by weight. So the healthy oils, olives, avocados, coconut oil. The healthy vegetable oils like canola, safflower, and soy are extracted from chemical solvents, and they create those trans fats. And trans fats are the not good fats. They cause inflammation, increase the risk of heart disease, stroke, diabetes, obesity. So if you're going to have fat, you really want to focus on those healthier fats, olive oil, avocados, those types of oils. And so when you have too many of those trans fats, research has shown that you can increase your risk of depression. So again, while if you have a patient with depression, you're not saying, hey, well, if you eat these healthy fats, your depression is going to go away, but you're going to be helping their brain function better. And so looking at nutrition and how does it help our patients is really kind of what we want to be talking about. And there we go. I did it. I made it through. I'm pretty impressed with myself on that. So I'll go back to Dr. McMillan, and we can open it up for questions or comments.
Thank you. Thanks so much, Malcolm. That was a really great presentation. I had myself just one question. I don't know if you know, or Michelle maybe knows, with the magnesium. I've heard of this just a little bit more recently with anxiety. Actually, the magnesium can help quite a bit for anxiety as sort of a supplemental approach. I always worry about that a little, just with sort of electrolyte balances, and I don't know, it's, it probably needs to be in a pretty tight range. So just if you have any thoughts on sort of, if you know what the safe doses for that would be, or what doses you take, Malcolm, that you've found to be helpful.
I just take a magnesium citrate, and I don't know the milligrams. I just take one a day. And I don't know about anxiety. That'd be interesting, because I do have anxiety. That'd be interesting, but I don't know. I'll defer that to Michelle. She would know more about how much is recommended, et cetera, et cetera.
Can you hear me?
Yeah.
Okay, super. That's interesting. I haven't refreshed my memory on the magnesium for anxiety. I know the magnesium citrate tablets usually come in 400 milligrams, I think, or is it micrograms? I think it's milligrams. Which is interesting, so I'll have to look that up. The one thing I get concerned about electrolyte abnormalities, especially with the rhythm of the heart. So that, and then also diarrhea, because magnesium can cause diarrhea. So, but other than that, I mean, it's worth a try on the diarrhea.
What was that last part you said, Michelle? You said, I couldn't hear.
Oh, magnesium. So one of the side effects of taking magnesium is diarrhea.
Oh, okay. Oh,
yeah.
All right.
Like milk of mag, for constipation,
sure.
Things like that. So you have to be careful with that, especially with patients with GI side effects, and then also cardiovascular effects.
Gotcha. That makes sense.
So.
Cool. Thank you.
I'll have my student look into the magnesium referring data. You
can report to us next week, right?
He's presenting to us next week.
That's right. So there we go.
Thorough in the beginning.
Excellent.